The broadcast is now starting. All attendees are in listen-only mode.
Good morning and really good afternoon. I'm Julia Talbot, and I am welcoming you to the Department of Family and Support Services Health Promotion Services RFP for the Austin Satellite Senior Center. I am joined here today by Mr. Sean Dolan, the Regional Director, and I think later we might be also joined by Yolanda Curry, and perhaps our intrepid Senior Division Deputy, Margaret LaRaviere. This is for the Austin Satellite Senior Center RFP. The due date is August 9th, 2022 at 12 noon. You'll hear that date over and over because it's important to us that you get this on time. Due to the volume of participants and really just DFSS policy, everybody's been placed on mute. There will be times for us to have questions after the presentation, and we usually stop midway between the substantive part of the RFP before I go into my administrative spiel about how to do an application in e-procurement to do questions. We'll do questions after I do the spiel on e-procurement, but we like to have people put their questions into the question box. If you have any problems with the any kind of technical issues you want to share with us, we also ask you to put those into the question box as well. Here's our agenda. As you can see, we're going to do welcome and introductions. We're going to go on through, and then here around the timeline, Sean and I will transition. And Sean will hand it over to me, and I'll talk about the technical assistance and the application stuff that you need to know about to make your submission experience that much smoother. At this point, I'm going to turn it over to Sean, and let's take it away. Thank you so much for joining us.
Thank you, Julia. And yes, thank you to everyone that has joined us for this webinar. We'll get going here. Next slide, please. So we already did the introductions. The purpose of the RFP, we are seeking to procure one delegate agency to provide health promotion services to older adults age 55 and older at the Austin Satellite Senior Center, which is located at 5071 West Congress Parkway, in addition to offering online and telephonic program offerings. Next slide. So this is just some background information. As the local area agency on aging for the city of Chicago, our division coordinates and funds services for older adults, and we prioritize those in greatest economic and social need, those who live alone, and those at risk for institutional placement. Working in collaboration with Aging Network partners, our division's efforts are guided by supporting older persons to live independently in their own communities and homes for as long as possible, ensuring that those who reside in institutions are treated with dignity and care, and then lastly, guaranteeing that older persons have access to accurate information to participate in public policy. Together with our service providers, we have been providing health promotion services to older adults for the past 2 decades. And then funded by Title 3B, Title 3C, and Title 3D of the Older Americans Act, the OAA, State of Illinois General Revenue Funds, and Community Development Block Grants, CDBG. These services have been designed to empower older adults in remaining healthy and safe within their homes via online and telephonic programming, and communities via programming at neighborhood senior centers and community site locations. So there's 3 goals for our RFP. It is to assist older adults to increase health awareness, increased self-determination in managing their health, and increase positive health behaviors. Next slide. So the current state and priorities for improvement. In fiscal year 2019, pre-pandemic, over 6,000 unduplicated older adults participated in our health promotion services, and there were 5,000 units of service, which is one activity session or an hour of related service provision, were performed among the city's 21 senior centers. Although this RFP, please note, is just for the Austin Satellite Senior Center. In fiscal year 2020, amidst the COVID pandemic, over 3,600 unduplicated older adults participated in health promotion services, and that was both in person and over the phone and online, with over 2,800 units of service performed, and that was among, once again, all the city's 21 senior centers, but once again, this RFP is solely providing services for the Austin Satellite Senior Center. Please note the selected respondent is expected to assist with outreach efforts to increase the number of older adults accessing services. And due to the pandemic, please note that the Health Promotion Services seeks to further expand our social isolation programming, such as wellness discussion groups or other innovative initiatives, and our online and telephonic activities to complement our traditional in-person services. So our target population is community-based older adults who are 55 years of age and older. And there's some additional prioritized subpopulations. That is older adults living in medically underserved areas, older adults demonstrating greatest economic need, with particular attention to low-income minority individuals, older adults at risk for institutional placement. And then there's additional special populations, older adults with limited English proficiency, and older adults with disabilities. Next slide. Sorry, 1 second. The Health Promotion Services RFP will select one respondent to provide health promotion services via online and it's going in and out. Okay, and over the phone platforms and in person at the Austin Satellite Senior Center. So the selected respondent will be responsible for overall program management, including assisting with outreach efforts, as we noted before, to increase participation, incorporating best practice and evidence-based standards, and utilizing health professionals. So that is a registered nurse, a licensed clinical social worker, or a licensed social worker under the supervision of a licensed clinical social worker, a registered dietitian, and a pharmacist, and all with previous geriatric experience preferred to deliver the program's core services. And then lastly, evaluating and reporting client satisfaction. Next slide. Program requirements. So there are core services as a part of the program. There are 5 of them. The first is health education. This entails scheduling monthly health education presentations facilitated by each of the health professionals that I mentioned in the previous slide at the Austin Satellite Senior Center and online or over the phone. Deliver 1 or more administration for community living, ACL approved highest tier evidence-based workshops at least twice per year or as demand dictates at the Austin Satellite Senior Center and online or over the phone. Establish additional health education programs as demand dictates. There's also health screenings. This entails scheduling health screenings such as blood pressure checks facilitated by the nurse and the pharmacist at the Austin Satellite Senior Center and offer health referrals when needed or necessary. One-on-one consultations. So this core service entails scheduling one-on-one consultations between each of the healthcare professionals and the older adult participants at the Austin Satellite Senior Center and online or over the phone. And once again, offer health referrals and supportive services when needed or necessary. Then there's also mental health support groups. So this core service entails scheduling monthly mental health support groups facilitated by the social worker at the at the Austin, Satellite Senior Center, and online or over the phone to assist older adults successful adaptation to life changes and losses, and offer health referrals and supportive services when needed. And also within this core service, establish additional support or educational groups as demand dictates. Then lastly, the last core service is social isolation programming. And this entails providing ongoing social isolation programming. For example, wellness discussion groups, virtual programming, brain health activities, and other innovative initiatives for older adults. Facilitated by the social worker at the Austin Satellite Senior Center and online or over the phone to address isolation and loneliness among the targeted older adult populations that we previously talked about in the previous slide. Next slide. So as we sort of mentioned before, program requirements for units of service. 1 unit of service equals 1 activity session. So that is a health education presentation or a mental health support group or a health screening or 1 hour of related service provision. And please note that the selected respondent is authorized to propose a per hour unit rate for the services offered as described in this RFP. And travel, paperwork, planning, and administrative duties will be included in the unit rate reimbursement. And we'll talk about this in some of the later slides as well. Next slide. So due to the pandemic, we have some emergency contingencies. So please note that special emphasis should be placed on developing contingency plans for any emergencies, for example, pandemics, storms, tornadoes, heat waves, etc., that require a change in programming. For the health promotion services RFP, all services are to be moved to online or over the phone platforms in case of an emergency or a shelter-in-place order. Next slide. This is our program requirements, our staffing qualifications and requirements. Please note that the selected respondent must employ a registered nurse, a social worker, a registered dietitian, and a pharmacist according to the following specifications. So provide a registered nurse for 2 to 4 hours a week, a social worker for 2 to 4 hours a week, a registered dietitian for 2 to 4 hours a month, and a pharmacist for 2 to 4 hours a month at the Austin Satellite Senior Center and online or over the phone as demand dictates. Ensure an adequate number of qualified and experienced staff to effectively coordinate and or perform the expected core services that we talked about in the previous slide, and have a backup plan in place in the event of staff absences. Verify that evidence-based program instructors or leaders have the appropriate training, program licenses, and certifications or credentials. Offer consultations, assistance, and education or training to the senior center staff on addressing older adult clients who are in need of physical, mental health, and or cognitive support. Provide a wellness program schedule for marketing publications. Assist with health-related special events, initiatives. Participate in meetings with other contracted awardees and with the city to coordinate citywide health promotion services and resolve problems. formulate strategies to engage older adults who do not access our services, and develop innovative approaches to enhance program stature. And then lastly, comply with all applicable laws, ordinances, policies, procedures, regulations, rules, requirements, and executive orders relating to background checks. Client contributions. So the selected respondent may not charge for any of the program services pursuant to the Older Americans Act. All participants must be provided the opportunity to contribute or donate to the cost of services. Contributions are strictly voluntary, and please note that all collected income must be used to expand the services of the provider and supplement, not supplant, funds received for the program. Next slide. So this slide has to deal with our goals and outcomes. We're seeking respondents with evidence of strong past performance against desired outcome goals. Our department will monitor through the selected respondents' client satisfaction survey a set of performance indicators that may include but are not limited to 75% of participants will increase their health awareness as a result of this program. 75% of participants will increase their self-determination in managing their health. 75% of participants will increase their positive health behaviors, and 85% of participants will be satisfied with the service delivery. We also intend to track output metrics that may include, but are not limited to, the number of unduplicated program participants, the number of new program participants, the number of service hours provided, and the number of referrals that the health providers or health professionals provide to other health professionals. Contract management and data reporting requirements. So the selected respondent will be expected to collect and report client level demographic, performance, and service data, that is program attendance, unduplicated participant count, and units of service provided for the month, as stated in the RFP and in any resulting contract. The respondent will also be expected to collect periodic feedback from program participants about the effectiveness of provided services, generate client satisfaction surveys to track performance measures, as we talked about in the previous slide, implement policies and procedures to ensure privacy and confidentiality of client records for both paper files and electronic databases, utilize the division's information system, and then submit reports electronically to DFSS. Next slide. So please note, as we sort of briefly mentioned already, this RFP has a cost proposal workshop that's in place of the traditional submitted budget. So this allows respondents to indicate the proposed unit rate for their different health promotion professionals. So that is the unit rate for the social worker, the nurse, the dietitian, and the pharmacist. You will have a chance to propose a unit rate for those professionals in the cost proposal worksheet. Next slide. So the contract under this RFP is from September 1st of this year until September 30th of 2023, based upon need, availability of funding, and contractor performance. We may extend this term for up to 1 year. Please note, though, that this contract will operate on a reimbursement basis only. There are no advances. One delegate agency will be awarded based upon the continued availability of funding levels, and there's an estimated annual site reimbursement allocation for the Austin Satellite Senior Center of $11,250. And as we talked about in a couple of the previous slides, the respondent will be required to complete a cost proposal worksheet, providing an estimated annual service volume for all the 4 health promotion professionals for the Austin Satellite Senior Center. Next slide. So the next couple slides have to deal with selection criteria, and this first one deals with strength of proposed program. So the respondent clearly defines health promotion services to be provided directly or through partnerships with other agencies that are appropriate to addressing needs of and achieving desired outcomes for the targeted older adult populations. The respondent's proposed service plan is supported by strong evidence-based programming and aligns with best practices for the relevant field. The respondent demonstrates a clear understanding of the older adult target population, of the area and their needs and challenges, and details past experience serving this community and its residents. The respondent has an effective approach to identifying and recruiting program participants, both from within and outside the Satellite Senior Center. The respondent demonstrates experience providing health promotion services, both virtually and in person. And the respondent identifies successful engagement and retention strategies for health promotion services. Next slide. Performance management and outcomes. So the respondent demonstrates evidence of strong past performance against desired outcome goals and performance metrics and/or other notable accomplishments in providing services to the target population. The respondent has the relevant systems and processes needed to track and report performance on program outcomes. The respondent has experience leveraging data, including client feedback, to inform and improve its services or practices. The respondent has the relevant systems and processes needed to secure, collect, and store key participant and performance data. And lastly, the respondent incorporates client feedback and input to evaluate and improve service delivery. Organizational capacity. The respondent has the relevant capabilities and/or infrastructure needed to manage this program. The respondent has qualified staff responsible for program oversight and management. The respondent has adequate HR capacity to hire and manage staff. The respondent has adequate systems and processes to support monitoring, program expenditures, and fiscal controls. And then lastly, the respondent's organization reflects and engages the diverse people of the communities it serves. Next slide. Reasonable cost, budget justification, and leverage of funds. The respondent conducts an audit. The respondent has the fiscal capacity to implement the proposed program. The respondent leverages other funds and in-kind contributions to support the total program and administrative cost, for example, state or federal funding. And lastly, the respondent demonstrates reasonable implementation cost and funding requests relative to its financial and human resources, and the proposed budget supports the proposed scope of work or work plan. So with regards to attachments, please note, or please be sure to attach job descriptions and resumes for all the 4 health professionals, the nurse, the social worker, the dietitian and pharmacist, and also for the program oversight or the general management staff. Also, please make sure to attach the cost proposal worksheet that's in lieu of the budget. So the timeline, we're having the webinar right now, but applications are due on Tuesday, August 9th at 12 p.m. And then once again, the program period begins on September 1st. Next slide. Another friendly reminder, applications are due, I think this is the 3rd reminder already, due on Tuesday, August 9th at 12 p.m.
There are we don't like to, we very rarely to never extend our deadlines. We will tend to re-release. And we would very much not like to re-release this particular RFP since it's already been re-released. So that, I think, concludes what Sean has to say. I'd like to open the floor for questions. If anybody has questions about the program that they'd like to ask, this is a great time to do it. And then if there aren't questions, or after the questions happen, we'll move on to sort of the more administrative part of the webinar. This is about how to make the application in the e-procurement environment. And then we can kind of like go from there. If there aren't questions right now, I think I'm going to just sort of start gently easing into the wild and wonderful, wacky world of e-procurement. I took a brief look at the people who had signed up for the webinar this morning, and I think everybody is pretty much, probably this is going to be redundant for you. But anyway, but let's just go there. So if you've never done business with the city, you'll need to register start an iSupplier account for your organization in order to access the e-procurement system. So the iSupplier is sort of the vendor account that the city uses. E-procurement is where the contracts sit and the operations that you would do to a contract would occur. So our RFPs are in e-procurement. Any kind of finance, vouchering, reimbursement kinds of stuff, those functions are housed in e-procurement. You use your iSupplier account, which you as an individual organization control to access e-procurement. It takes a couple of days to set that account up. You fill out a screen, you send something in, you get something, you get an email back that sort of lets you set it up. That's all done by our Department of Procurement Services, and it often takes a few days to get that started. Just as a result, just as like a kind of a pro tip, much of what you'll be sent from the iSupplier / e-procurement systems often ends up in spam. It ends up in my spam. It ends up in probably Sean's spam. So make sure that you check that spam frequently, especially if you're expecting something from e-procurement or from iSupplier, in terms of a password reset or a link or some sort of communication. So that would be my first thing to say about iSupplier e-procurement. If you look at this is reviewing the RFP narratives. So our narratives or our program requirement sections align with our application questions, and those also align with the selection criteria. The selection criteria we use to sort of triangulated with the application questions we use to develop our evaluation tools. And so all of these things are interconnected. So I always encourage people to use the RFP document that we have attached in e-procurement for guidance in formulating your answers. If you come to a question that you're not quite sure about the direction of, that what do you which way do you like where to go? I would look at those scopes to kind of like figure out where we're going. I do encourage people to carefully review the selection criteria. That also, that's what we're going to be using to evaluate you. There's a 4,000 character limit, which includes punctuation and spaces for all of our answers. And so each response is allotted 4,000 characters, not the entire application. That is a hard limit. Somebody asked me that a couple of weeks ago if it was a soft limit. The system is just going to cut you off, basically. It's not going to tell you that it's cutting you off. You might not even be able to see that it's cutting you off, but it will, in our view, cut you off. That's why I tell people to do our application questions in a word processing software that will allow you to count those characters so that you know when you hit 4,000 characters and you can cut and paste it. The other thing e-procurement doesn't do is give you a final copy of your a final complete copy of like all your attachments, all of your answers and stuff. You can get a sort of a final view, and we'll see that when I walk you through how to submit. So when I talk you through how to submit, I can show you where there's like a printable view. But once you submit that RFP or that application to us, it's sort of sucked away. You don't have access to it any longer. So I always tell people to keep a file copy of the application questions and the application that you say that you have. It's especially useful if you are funded from us, that you actually know what you said. There's any number of people that we've had to send a copy of their application back to them, and sort of we get a PDF version, we send it back. That's never a fun conversation to have, right? Another sort of like just housekeeping, don't use the back button on your browser when navigating in the e-procurement environment, because it's not gonna, what will happen is that it will stop sort of recording what you're doing or saving. When you go to save, you'll get an error message and nothing will have been saved since you had hit that back button. You can navigate through in e-procurement using usually anything that's in kind of a light blue font will take you to another thing. You can you will learn to navigate back and forth without using that back button. So my mantra for doing any kind of RFP or application for us is to start early and save often. I have an RFP due tomorrow, and I can see people who have not started early. If nothing else, just go in, make sure that you get access, that you remember that password, that you know how to get to your application. You don't want to do those things 48 hours out or 70 or even 72 hours out. Doing a grant proposal is stressful enough. Don't make it more stressful for you. So I always tell people to start early, to save often. Understand that in e-procurement, you can submit your application and later amend it up until the due date in time. So you can practice submitting and pulling back if you want. I always tell people to, consider submitting early, if not like a day early, at least a couple hours, and to plan on your submission taking 30 to 60 minutes. One of the reasons that we've talked about the application deadline is that we really don't do late applications here. Finally, make use of the e-procurement hotline or helpline at 312-744-HELP or 4357. But note that the hotline operates business hours, Monday through Friday, 9 to 5. You can also call me for sort of your more basic e-procurement questions. If it's beyond, I have a certain level of operationality into the system. If I can't help you, I'm gonna have you call the helpline. But I can sort of your basic stuff. I'm often very helpful for. Plenty of things plenty of screenshots I can send you. On that note, if you're interested in other opportunities with us, you can go to the DFSS website and look at the alerts section of our website. We also post everything in the funding opportunities section, and they're posted by the individual opportunity. Thanks to the American Recovery Plan and just our general funding, we have a lot of RFPs coming out this year. We've put out a lot, and we have even more to come. If again, for questions that you have about register or e-procurement stuff, call the helpline, email them at customer support. And if you're the kind of person that really just prefers to do stuff on, get your technical assistance online, not talking to other people, there's a lot of training materials, both documents and screenshots and videos at this particular website. Just so that you all know that this webinar is being recorded, but this recording will be posted at the DFSS YouTube site, a link of which will be posted on the funding opportunity page for this RFP on the DFSS website, along with the PowerPoint slides. So those things will be posted in probably the next 48 hours. And then so you can relive these moments with us or go back if you wanted to just see a particular slide. And then you can also look at the PowerPoint slides too. So there's two different things that we like to do in the as part of the application that you can assume you're going to have to deal with. One is accepting an amendment, and the other is submitting your application. So to accept it, we do an amendment to more or less if we need to change anything, but that's where we post the questions and answers that we receive in the webinar or from potential applicants. So in how to accept in a webinar or an amendment rather, we're going to walk through these screens. So if you have not started an application, which would be this screen, you're going to go into this, you're going to sort of start your application. You'll get this warning. and then you're going to click on the View Amendment History in blue here. If there hadn't been an amendment, you would just go to this action bar on the right-hand side and do the Create Quote from the pull-down menu and click Go, and that would put you into your application phase. But because you have an amendment, you're going to click this View Amendment History, and that will take you to the following slide where you begin the acceptance and acknowledgement process. So to review the amended changes to the RFP, you're going to click on the infinity or eyeglass icon here on the right-hand side. If you just want to look at the document, you want to open the RFP in view only, you're going to click on this number 1 here. You can see also in the middle here, this amendment description. That's sort of a one sentence of like what the amendment is about that I write. It will say something like, this amendment has the FAQ, the questions and answers from the webinar, or this amendment, if it has something of substance, like, oh, we're changing the due date, or we found this error, we switched this question, etc. It will say in this little one sentence, sort of like the synopsis sentence. After you've looked at all these things, you're going to acknowledge the amendment by clicking on one of the buttons on either the upper or lower right-hand side. And then it will take you to this screen where you're going to accept the acknowledgement. So you're going to hit this little tiny button here, you're going to check it, and then you're going to acknowledge that you read the amendment and that you know that the material and information in the amendment you will be held responsible for. After you hit acknowledge, you're going to come to this confirmation screen, which you're going to hit yes. If you hit no, it will just take you back to the other things. And so, to the other screens. You're going to hit yes, and that from hitting yes, you will then come to this final terms and conditions screen where you accept the terms and conditions by clicking on the small button on the lower right-hand side. Then you're going to hit accept, and that will take you, is the final step, and you will now be allowed to either continue your application or start your application with us. The next we're going to do is talk about how to submit an application. And for this is I like to I just tell people, just please give yourself enough time. Do not run the clock on this. It always takes longer than anybody wants it to. So when you are ready to submit your application to us, you're going to start by saving your draft one last time because, hey, why not? Saving drafts is a good thing, right? And then you're going to hit this continue button. At this point, the e-procurement system is going to kind of just do a brief scan of your entire RFP, your application, and sort of do highlights about what it thinks it might be a problem. It doesn't read anything for content. It just is basically checking to see if you filled out the application correctly. So you're going to get most likely you'll get any number of error messages. That I'm going to go through the two most common error messages here. One is you must quote at least one line in the RFQ. In this case, we require that you do a cost proposal that you're going to upload to us, but e-procurement also has a sort of a budget area where it wants you to put in lines. We don't look at these lines as part of our evaluation, but you're still going to get an error message saying, please fill these lines out. You can see here there's this little lines tab right below you must quote at least one line in the RFQ. When you click on that lines tab, you're going to see you're going to basically see a budget page. For this, I'm going to ask that you fill in placeholder numbers. You can fill in any number you want, but it should be a number. Once you do that, that error message is going to go away. And we use the lines as part of the contracts process, but we do not, again, use that to review any part of your application. It's not part of how we make our funding decisions. Here's another error message that you might get. It says here a quote value is required for requirement first name. And in this case, even though it seems a little, who knows what that means, right? Quote value is e-procurement speak for your application question answer. Requirements is the section that's basically your application question section. And then the first name here is the name of the question that did not fill out. So in here, a quote value is required for the requirement first name is basically saying you forgot to fill out the answer for this question about first name. Please fill it out. Once you do that, again, the error message will go away. So at some point, once your application is free from errors, you're going to be ready to proceed and submit. At this point, when you click continue, the application will go into this review and submit phase. And at this point, you see this printable view. This is where you can get a printable view it will be formatted for e-procurement. It will be a PDF, but you can get a printable view of your application with all the answers, and a list of the attachments. It won't print out your attachments for you, but it will tell you what you did upload. I highly, highly recommend that you do that, just because it's nice to have that kind of hard copy, if you will. So when you're in the review and submit page, after you do your printable view, you can basically scroll through your entire application. You'll see it here. You'll just keep scrolling. You can do that last check. And when you get to the bottom, here are your lines that you filled out, the placeholder numbers or the real numbers, however you want to do it. And when you get to the bottom, you're going to do an electronic signature. You're going to do putting your name and your title, and then you're going to click this box. If you click the box first, you get an error message saying putting your name and title first. And then I could not fit this all in one screen, but on the far right-hand side of the same screen, you're going to have this submit button, and you're going to push the submit. And at that point, you're going to see this submittal confirmation screen. The e-procurement system will send you a confirmation email within 24 hours of your submission. But if you want to know what happened, you want to know beforehand, please don't hesitate to call or email me, and I can confirm immediately. I can see that you've submitted, and I can confirm that for you. It's really not a problem. I know that sometimes turning in an application can be like a real nail-biting experience, and there you go. This is how you submit an application. So at this point, it's time. If there are any questions, this is the time to do it. Here are programmatic questions. If you need to get a hold of me for non-programmatic stuff, this is my email address. This is my phone number. For program questions, we have Margaret LaRaviere, her contact information and email address. I don't know, Sean, did you want to put maybe your email address into the chat or the questions section for people if they need to get a hold of you for some reason? I know that you're also available for questions. And then, of course, now we can open up the floor for questions. I see here somebody asked, 14 business days since the announcement came out is a quick turnaround, but thank you for confirming the date one. Oh, well, that's not a question, but thank you very much, Ms. Rodriguez Morales. Yeah, 14 days is about as quick as we do here. But as we did mention earlier in the webinar, this is sort of a re-release of stuff. And so we're hoping that we can turn this around and get the contract onto the street as quickly as possible. So, Sean, is there anything that you have to add?
I don't have anything to add. I don't know if I know Yolanda and Margaret were trying to join. I don't know if they joined somehow, some way. I don't know if they have anything else that they wanted to add.
Yeah, I see here. It looks like maybe somebody joined. If they want to unmute themselves. If there
Hi,
are...
can you hear me?
Margaret?
Yes.
Good afternoon. I just want to thank everybody for attending this webinar. And as Julia shared, our contact information is available for any questions that you may think of later.
There are no questions at this time. I'm going to give you some time back. Thank you so much for attending the webinar today. We're really looking forward to seeing everybody's applications. And thank you so much for considering this opportunity with the City of Chicago to provide such vital services for Chicago's senior or older older residents. And we look forward to seeing your applications in a couple of days. Sean or Margaret, is there anything you'd like to add?
Just to chime in, yes, thank you again for your time. And yeah, we look forward to your applications.
Have a good afternoon.
Thank you, everyone.